So let's talk about the PureWick. So what does the PureWick do? Essentially, it collects urine from female patients using suction. These are the parts of the PureWick. We have the suction tubing, we have a gauze portion, and we have a rubber backing which keeps the urine in the PureWick. The upper portion, this will attach to the suction. Regarding this portion of the PureWick, just know that it's going to align against the pubic bone for proper placement. This gauze section, this is what will be suctioning the urine into the suction canister. And this portion, just know it will be tucked snugly between the gluteus muscles for correct placement. Now the first step to placing the PureWick is for the nurse to set up suction, but once suction is set, PCAs and NAs can remove and place the PureWick. When setting up suction, the nurse will be setting it to continuous low suction. The minimum is going to be 40 millimeters of mercury, and please always use the lowest suction necessary. Now for step 2, we simply connect the PureWick to suction. Step 3, we perform perineal care. Step 4. So to place the PureWick, we're going to separate the patient's legs. Please place the PureWick on the patient. Never insert the PureWick into the vagina, anal canal, or any other body cavity. When placing the PureWick, please make sure that the gauze side is facing the patient, because again, the gauze is what's going to suction the urine. Tuck gauze side between gluteus and labia, but if you're unable to do that, you could keep the PureWick in place using mesh underwear. Once the PureWick is positioned, close patient's legs. How do I remove the PureWick? Well, you're going to keep suction on during removal so that the urine doesn't fall out of the PureWick. We're going to separate the legs and gluteus and labia. And to avoid skin injury, we're going to gently pull the PureWick directly outward, not up and down. And then we can dispose of the PureWick. How often do I change the PureWick? Immediately when soiled with feces or blood, or at least every 8 to 12 hours. Now here's a list of patients that you could use the PureWick on. If you're monitoring urine output, if they're incontinent of urine, if they're immobile, if they have a bed rest order, if they have difficulty ambulating to the restroom, or difficulty using the bedpan. Here are some recommendations. Never push or pull the PureWick to avoid skin injury. Again, we're going to remove the PureWick directly outward. Do not use barrier cream on the peri area. The barrier cream tends to impede suction. After turning your patient, please check that the PureWick is still in place. And if you feel uncomfortable placing the PureWick, have a female colleague assist you.